Hello everybody and welcome to another update on the COVID-19 pandemic. I'm Dr. Schalk from Dr. Luke on Call. Today it's very important to discuss where we stand at the moment across the world and also in South Africa and in any other country that is at the stage where we are, which is in phase 2, sort of at the end of phase 2 and almost waiting for what's going to happen next. We have now reached the end of week 1 of lockdown. And the question is, what are we going to do? What is concerning is the fact that this is now where we get to the true test. But if you look at the roads or listen to the roads for these people that are actually allowed to drive, there's a lot more people out in the shops today. Towards the end of the week now, there's a lot more people just being outside and almost disregarding what is requested by our president. I really think it's going to be crucial to understand the following points. Why do we see low numbers? The curve. What does the curve look like and what do we want to try and achieve? Stay home and why stay home? Protect our elderly people and how are we not going to protect them? And East versus West. So if we look at those things a little bit in detail, the true test comes after week 1. To have a lockdown for 1 week is going to have a certain effect. Less people will be tested because people are at home. You're not going to have a lot of symptoms. People are not going to actually go out and test because they're now forced to lock down. So the numbers will definitely look a little bit lower, which is obviously ideal, but it's probably just the calm before the storm. If you look at every other country that is maybe 2 weeks or 3 weeks or 4 weeks ahead of the curve, you can clearly see the pattern. And that is what's really, really important. We've got to stay vigilant, we've got to stay disciplined and do what is expected of us. If you just have a rough idea of the curve, China's had a fairly steep curve, but they managed to bring it down a lot, and at the moment they're sitting around there. They get a slight little second phase like that. Okay, that's manageable. It was quite chaotic there, but they were the first country to go through this whole problem. Countries like Japan and South Korea, they've managed to actually bring it down like this. So what do? They've got very, very disciplined regulations and rules. They keep their social distancing, they do what was asked of them, and it's in their culture, it's in the Eastern culture to really do the right thing, keep doing the right thing for the greater community. Then you get our European countries and Northern America. It's really concerning because you just see these curves going up and up and up and up and up. That's sort of the United States curve. Great Britain is doing a very similar thing. We all know about Italy. Italy has gone all the way up, 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 up. They've turned a little bit now. They're somewhere there. The same thing, is happening in the UK. They've also got very, very high numbers going straight up all the way like that. United States, as you know, have not got lockdown. They're only using social distancing. And the reason for the lockdown is it's got huge complications for the economy, for people living in shelters, in places where there's not enough space, for people not being able to go to work, earn a living, get food on the table. So in the short term, doing a lockdown in a country is almost devastating, but not doing a lockdown would be far, far worse. So I really want to ask you and plead with you that we need to keep on doing the right thing. Remember, our children are the ones that are going to be safe. Our children, still the numbers across the world shows very, very little active or complicated infection in children. The children has a situation where, if you look back 2 videos where we discussed the immune system, their innate immune system, the immune system that's non-specific, the patrol cars, I don't know if you remember the patrol cars, their police cars, are very active, and those cells, the dendritic cells and the macrophages, and all those cells are very active in killing the virus very quickly. They get a fever very quickly and they ill for a few days or not even that bad, and they get better. Before they get to phase 2 of the immune system, where you get all the antibodies and all the chemicals that get secreted, and that really causes the high risk and the lung infection, and the patients having to be admitted at that stage. And that's where our older population lies. And we want to try and protect them. So coming back to the point there, our older populations, our grannies and our grandpas and all those ones, all the learners here, you've all got grannies and grandpas. We want to protect them because they will really struggle with this. And it's our responsibility to do the right thing. This morning, someone that I know was in one of the well-known stores to go do some shopping. And there was a adult woman that took both granny and grandpa out of the car, and all 3 of them went into the busy store together to do so-called essential shopping. That is just a lack of understanding of what is really lying ahead. And I want to really stress this point. We need to protect our older population. If they get exposed, they will really, really struggle. East versus West is, what I was talking about as far as cultural behavior. And the question is, where are we going to be? What's the continent of Africa going to look like? Are we going to follow the Western attitudes and the Western behaviors and say we'll sort of do it the way we want to? We'll follow our own path? Or are we going to look up to our Eastern neighbors and say, if the regulations are laid down by the governments and the powers that be and the ministries of health, let's comply with them. Let's do the right thing and make sure we protect our people. We will go back and work eventually. We will go back into our community. It depends on at what cost. That's really the concerning thing. I know it's been a difficult time, but persist. Do your work from home if you can. Keep on studying. My daughter and I are learning Mandarin. She's doing Mandarin at varsity, and I'm started doing Mandarin with her, and it's an exciting journey for me. I like that. I do a lot of research on the internet and doing some webinars and talks like that. Keep yourself busy. Plan your day. Structure your day. Do certain things. Keep active. Get outside if you can a little bit. Those are all practical things. Remember, from a diet point of view, fruit and veg is a lot better than a whole lot of sugar and carbohydrates and those sort of things. Make sure you have your water. Make sure you have your vitamin C. Make sure if you can get a little bit of zinc, it's good. We will talk maybe in another video again about quercetin. Quercetin is a natural substance that we get in plants, and it's there to get the zinc inside the cells to help fight the virus. Those things are really important. If you do get a fever, if you do get a bit of a cough, stay home. It's important not to infect others. If you have to go out, you've got to cover your mouth. You can't cough in shopping centers or in places where other people get infected. Remember, shortness of breath and difficulty in breathing is a key for you to get medical help and medical assistance. If your oxygen levels go down and you struggle to breathe, you need to be examined and you need to be looked at. But please phone ahead and tell people that you're coming in. Do not just walk into a medical facility. Wait outside and inform them that you worry that you might have an infection. And then lastly, an important fact that we've now seen in some of the studies, temperature that your body develops is part of your immune system. It's protective. We have seen in studies that your monocytes, they increase when there's a high fever. So don't bring the temperature down too quickly. We want the temperature to stay there for a little bit longer. Even taking a warm bath, if you have the facility, is also a good thing to get your body temperature up a little bit. You can treat children's temperatures if they do we don't want the younger ones to be exposed to fever convulsions, they're very young, but in your older children and your adults, don't be too aggressive with temperature treatment, and remember, avoid the anti-inflammatories, especially ibuprofen. Try and stick to paracetamol, Panado type products. Thank you, and remember, stay home, stay healthy, and stay safe.